You're listening to Latinx Therapy. The information shared in this podcast is not a substitute for seeking help from a licensed mental health professional and is not a substitute for psychological diagnoses or treatment. I'm your host, Adriana Alejandre, licensed marriage and family therapist. Hey everyone, welcome to Sesión with Elena Apaza. On this episode, we explore what bipolar disorder is and everything that comes with it, including diagnoses that it gets confused with, common symptoms, problems with diagnosing bipolar disorder, how bipolar disorder is seen in children or not, how bipolar is seen in our Latinx culture, what people in our community do when they do not get treatment, and resources. Let me tell you about Elena. Elena Apaza graduated from Regis College and has been trained in mental health care throughout the lifespan. She is a board-certified advanced practice psychiatric mental health nurse practitioner and is a certified nurse practitioner in Massachusetts. Nurse practitioners work with people of all ages and their families and may conduct physical exams, diagnose, prescribe medications, and order lab tests or x-rays if needed. Elena specifically works in an outpatient mental health community center and a crisis stabilization unit. She specializes in bipolar disorders, but treats many different conditions too. For fun, she likes to enjoy time outdoors. She enjoys the nature and spending time with her family. Elena actually has a Peruvian background, and her favorite cultural memory is getting together with her whole family for the holidays. In regards to mental health, her family stigmatized it. Her family was not open to mental health problems. They were very religious, and you'll understand this in the interview because she talks about this very openly. Her family believed that it was simply a good versus evil battle. Learning that it is more than just a good versus evil battle has made her want to debunk this myth through research and education. Her end goal is to reduce stigma of mental illness and to reach as many people as possible. I hope you all enjoy this episode. Here we go. Hi, Elena.
Hi, how are you?
Hi, I'm good. It's so nice to see you again.
Yes, same.
It's been how long? Like about...
probably half a year since I think we met in August or something. August, September, somewhere around.
Yes, okay. We met in September, and I remember because I had a really bad experience after the beautiful experience that we had being deployed.
Yes, unfortunately, you got sick at the shelter. So we were volunteering at the shelter in Texas after Hurricane Harvey. So Unfortunately, Adriana got sick.
Yes. I was not able to see very well or walk really. And I had to miss about 3.5 weeks of work. But the work that we did, we had 12-hour shifts at the shelter, and we were really helping the mental health state of those people that were still without homes.
Yeah, so that was really, that was awesome. Working in disaster mental health is so different, and it's like a loss for any one of us. It would be. So it was really rewarding to be there and help people in a really difficult time.
Yeah, and since then, Elena and I have become friends. She's, as you heard in the intro, from Massachusetts, or lives in Massachusetts currently, works there as a psychiatric nurse. Mm-hmm. Yeah. And so for today, we're going to be talking about bipolar disorder specifically. And before we merge into that, I've been learning a little bit about Elena's history in terms of how her family has viewed mental health, and her background is Peruvian.
Mm-hmm. Yeah. So my family is also religious, and mental health has always been sort of like an evil and a good kind of battle. Mental health is not really acknowledged so much in my culture or my family. If you're depressed, they just say, hey, go to church and, God will lift your spirits, or, just pray and it'll go away. And so that's what I've seen all my life, just kind of like that doesn't exist. Es el diablo. So they think it's Satan or something. And over the years, I've learned that it's not the case, but that's how I grew up.
Wow. I'm just curious, how old were you when you learned that wasn't the case?
I guess probably like 18 or probably when I was in my undergrad. That's when we learned about psychiatric illness and what it is. And even then it was a little hard. And I was like, well, why don't these people just go to church or something? But I always, had my doubts. I never believed that it was truly just evil. I always had like, it has to be something. I just don't know what it is. It has to be explained somehow. And that's when I learned about psychiatric illnesses.
Yeah, that's so interesting. I think that's actually a really common experience in our community, where in our households, we don't learn about any mental health related issues. They go undiagnosed, unreported, even up until now. And people have that same experience where I actually myself didn't learn about psychology related things until my undergrad as well.
Yeah.
So what is bipolar?
Bipolar disorder is a mood disorder characterized by ups and downs. So there's two different types of bipolar disorders. There's a bipolar 1, which is the classic bipolar that everyone knows about. There's the manias and then the depressions. For that one, it's more of a clear cut, like when there's a mania, the manias last about a week. The person is not sleeping or sleeping very little. They have a lot of goal-directed activity. They can't stop talking. They're spending a lot. And these are some parts of what it could be to be in a mania. You're irritable, you're anxious.
And that's what a mania is?
Yes, so that it usually with a bipolar 1, it usually will last about 7 days, and these symptoms go on for most of the day. I always have patients plus or minus 7 days, so it's not, it's important to say like it doesn't have to be exactly 7 days, but it's usually around there.
Okay, and there's also another type.
Yes, so the other type is bipolar 2. Initially, they thought it was a less severe form of bipolar, but now we know that it's just a different kind of bipolar. And you no longer have this mania that's really elevated mood. It's more like a hypomania. People see a difference in you, but it doesn't necessarily impair your function. So in the bipolar 1, you're usually hospitalized because you're not safe to yourself or to others. In a bipolar 2, not necessarily. Bipolar 2 will work a little harder at their jobs or do a little more cleaning. Sleep is still less, but it's not as less as bipolar 1. Bipolar 1 can go without sleep. Bipolar 2 could have like 6 hours of sleep and still function, not be tired. They do have the symptoms of the manias in bipolar 1. So there's the increased goal-directed activity. There's a lot of hypersexuality, a lot of spending. They kind of forget that they have bills and they go to the casino or they go shopping and they can't really control themselves. So you still kind of see that, but it's no longer now in bipolar 1 is 7 days and bipolar 2 is going to be around 4 days or so. So it's just a little different. And it's important to know, to say that it doesn't have to be just like you're happy or giddy. It could be that you're irritable. And these two episodes, the manias and the hypomanias in both bipolar disorders, will also fluctuate with a depressive episode.
And I have a question. When you mention mania versus hypomania, can you just clarify what that means?
Yeah, so the mania is when it gets so severe that you're hospitalized. It's impairing your function. You can't do what you usually do at home. You can't go to work. You're talking too fast. Your mood is just so high that it's really not, you really can't just go on about your day and do your thing. A hypomania is a little less severe than that. So you're still maybe talking a little too fast. You're still working a little too much, but it's not impairing your function like the mania is doing.
Okay. And so there's differentials, right? There's things that get confused with this diagnosis.
Yes. When diagnosed as bipolar, it's always really important to make sure that nothing else is going on. So it could be symptoms triggered by substance use. So cocaine, alcohol could always cause symptoms, marijuana. There's a lot of things that could cause symptoms to come up. And then there's also medical conditions that could cause these symptoms to come up. So it's always important to make sure that medically we are stable before diagnosing bipolar disorder. Other things could be depression, schizophrenia, borderline. So it's really important to differentiate between everything that could be going on, and just make sure that we're digging in and finding the right one and treating it appropriately.
Yeah, that's right. I know that we had a question from Carolina who asked, what's the difference between bipolar, schizophrenia, and depression?
Okay. Hi, Carolina. Thank you for your question. So with depression, there will not be the elevated mood. So the manias and the hypomanias, you just won't see that in depression. And so that's the major difference with bipolar and depression. There's just the mood doesn't fluctuate like that. With schizophrenia is a psychotic disorder. So there's a lot more going on in the brain. There's psychosis, so there's hallucinations, there are delusions, and that affects a person's function. And even though there is that with bipolar disorder, in schizophrenia, it's unrelated to the mood. So it's kind of always there, and it always gets worse if there's no treatment. But in bipolar, if there are psychotic features, and that is, like the hallucinations, delusions, that'll only have to do with your mood, and then it'll kind of fluctuate with your mood as well.
What do you mean by that it'll fluctuate with your mood?
Yeah, so just to get things a little more confusing, some patients present with psychotic features. They'll have audio hallucinations, visual hallucinations, more so when they are manic. It just gets severe and they start hearing voices. That's the most common. And even depression, some people will have psychotic features because they're at a low. And so that is what happens with bipolar. But like we said, the bipolar is mania and depression, and it kind of goes up and down and it fluctuates. So when the mood stabilizes, the psychosis stabilizes. So there's no more hallucinations or anything like that. But in schizophrenia, the hallucinations will always stay the same regardless of the mood.
Okay. That makes sense. I hope that makes sense. And if it doesn't, we'll have a Q&A afterwards.
Yes.
Yeah. But overall, it's really important to not be self-diagnosing and to get this diagnosis or talk about your concerns with a professional, with a doctor, with a psychiatric nurse, and even a psychotherapist.
Yes. So, especially when you're in school, you always want to diagnose yourself because you're learning a lot of stuff. And I know I went through that too. So it's really important to be careful and not do that. Talk to a specialist, someone who's trained enough to do this for a diagnosis in bipolar disorder.
And I'm going to jump into our culture really quick.
Sure.
Because you're touching on a lot of things, I think, that are very common in, I want to say, our parents, where, growing up, we hear, oh, my mom is so bipolar because she goes from being really happy to mad within, seconds. So, I guess, where can we clarify in that regards within our culture? Because it's such a loosely used term.
Definitely. I've heard it all the time, and it's hard. I mean, I would say make sure there's an impairment of function, and that's what I usually do for any diagnosis. There's always have to be it's got to be impairing your function. So don't just throw the word out there. It's not just a label that you can just call your mom angry or call her and tell her, she doesn't know what she's talking about. But bipolar, it's a lot more than just your mom kind of yelling at you or changing what she wanted you to do.
Yeah, I completely agree. And, the detriment about using the term loosely and as a joke is that it continues the stigma, it continues the cycle of labeling and hurting those that actually have this mental health disorder that exists.
Yes.
Yeah.
Yes, unfortunately it does.
We were talking a little bit off the air, and you mentioned that this bipolar is not diagnosed very well.
Yes. So there is trouble with diagnosis of bipolar disorder. It's hard to diagnose. And a lot of times when I have patients in my office, I always like to have collateral information with bipolar disorder.
What does that mean?
Collateral information means like, you bring your husband into the office and then we talk with them, because a lot of the times your moods, especially in a mania or a hypomania, you kind of forget what you did. Collateral information is really important to diagnose bipolar disorder, but also genetics, family history. They have a lot to do with the diagnosis of bipolar disorder. And so when you want to go, usually patients don't come in and say, hey, listen, I'm really productive. I'm doing great at work. My boss says I'm doing great. So, I think I'm bipolar. No, that's not how it goes. Usually they'll come in and they say, I'm depressed. And then you really have to dig in and see, has this happened ever in your life that you didn't sleep for a few days and you were very productive? And so I think the trouble comes in where we just, we have to dig in and find evidence that it's really just a depressive episode, or it's really just whatever else it is, and not bipolar disorder.
Okay. And is there a difference between males and females in terms of how it presents itself?
So the incidence is about the same. So both have the same rates of bipolar disorder. For men, mostly bipolar 1 is seen, and also how it presents. This disorder is accompanied by times where you're very depressed and you're also very activated, like the moods kind of mix. And so men have just a higher rate of death because they're more activated, they're more impulsive, and they can complete suicides easier than a female would.
Why is that?
Because they go for more lethal means. So females usually worry about how they look, how they will look after or something, so they won't do something to their face, or so they'll choose less severe methods that can be easily corrected, bringing them to the emergency department. We clear out their stomachs, take out the pills if it's in that way. Men will do more lethal things like using a weapon, and that usually is more severe and less chances of survival when you're using those methods.
Elena, how young can someone be to be diagnosed with bipolar disorder?
Okay, so most recently we added a new diagnosis to our DSM classification, which is used to diagnose mental disorders. So it is called disruptive mood dysregulation disorder. And that was brought up because they want to have people steer away from diagnosing children. Usually the manias will come up around age 18, but it could be sooner. It's just they just want to steer clear from diagnosing a 6-year-old with a bipolar disorder and giving them this disruptive mood dysregulation disorder that kind of encompasses those symptoms, but it's not yet a full-blown bipolar disorder. And I think that just depends on, again, like how well one is digging through the symptoms and diagnosing. And with family history and genetics, that has a lot to do as well.
So they can be diagnosed at a young age, but It isn't necessarily recommended?
It's just they want us to steer away from that, just because it also, a lot of things don't come up until you're older.
Yeah. And I would imagine like hormones are going on, the kids are growing.
So it's hard to say, which one is causing that. But I have seen bipolar disorder in children.
Wow.
So it's, when it's there, it's there. If it's kind of like in the middle or something, that's why they want us to use this new diagnosis.
So we were talking a little bit prior about how it's seen in the culture. and how it's kind of made fun of. It's seen very lightly. There are other avenues to go about in terms of treatment, which in your family, it was God. But
Yes.
I know that that's also very common. And we actually have a really good question from Instagram. So the question is, how do you explain to Latinx family members that his or her relative, like a father, mother, brother, son, etc., have this personality disorder? So if we're understanding this correctly, how do we explain to another family member that someone else has disclosed to us that they have bipolar disorder?
Okay, so this is very difficult because there is a lot of stigma for mental illness, and especially in our culture, it'll be very hard to kind of like say, hey, this is real and this is going on. But I would probably say the most important thing is to get consent from that person who has the bipolar disorder. Make sure that they're okay with, disclosing this, because in reality, this is their health, this is their life, and they probably feel the stigma. So first of all, we kind of have to work with saying, listen, if we tell this person, they could help us better and they could understand your symptoms a little better and we could all work together. So first of all, get that person to agree and say, okay, let's do this. And then I would just say, have a conversation, all three of you. And I guess this person, I'm guessing you want to mediate or something. So I think that's great. I think sitting down, talking about, listen, for the longest time I've had these symptoms. I finally went to see someone and it's, they told me that I have this and I'm doing X, Y, and Z from now on to try and fix my symptoms. And I really want your support. So I think it's great that this person wants to know how to do that. I think number one, like I said, get the person to be okay with disclosing the diagnosis. And then what I always say is just talk and tell this person how you feel. Tell them, I really need to tell you what's going on with me. And I think that's probably the best way to disclose this.
Yeah, I have to agree. If someone tells you that they have this disorder, it's a mood disorder, so not a personality disorder. But if they tell you that they have this disorder, like Elena is saying, ask them for permission. What is okay to say and to who? And how can I support you? How do you want me to support you through this? Do you want me to connect you with therapist, with a psychiatrist, if they don't have a team already? So let's say they were diagnosed by a medical doctor. They need a team. So it's going to be really important, because I know oftentimes people who get diagnosed with something, they cannot think of doing any more extra work because they're already so overwhelmed with the diagnosis and grieving the loss of their future life, their idealized future life. So helping them in any bit that you can, that you're allowed to, is going to go a long way.
Yes. And I think that's the perfect combination. Getting a treatment team, but also having your family on your side and them knowing what's going on with you, they're going to be able to support you a lot better with that knowledge.
And let's say someone gets diagnosed and they go to a family member and the family member says, ay, mijo, let's go to church. Vamos a la iglesia.
Yeah.
What would your response be in a situation like that?
I can see myself in that situation. I've actually told my mom a lot of, like, this person has, very severe depression. And she's like, oh, it's because they don't go to church. And it's very difficult, especially in our culture. We have a lot of other beliefs too, that I don't think that going to church is wrong. I just think that it's not an evil versus good. It's actually based on what's going on with the chemicals in your brain. So I think it's just education for that person. Mom, dad, grandparents. I would probably, take a step back, give them a little time. And there's also some grieving with learning that your loved one has a mental disorder. All your life going through life saying, mental disorders don't exist. And then all of a sudden your child tells you that they have bipolar or anything. So I think for parents or loved ones, it's very difficult to accept that as well. So there could be a little bit of denial. And so I always thought, in my family, okay, they're in denial. Like they don't want to accept that this could happen. And that was my explanation to them. But I think it's very difficult for someone to accept that a loved one is suffering from a mental illness, especially when their culture kind of tells them that it doesn't exist. And I would just say more education. And, if church is something that you believe in, then absolutely go to church. It's not going to hurt you. But I think it's also would be helpful for support.
Yeah. As a supplemental. So it'll be part of the team.
Yes.
Mm-hmm. Yeah. And when Latinos and our Latinx culture community, when they do not seek professional help, what are things that you've often seen them do instead?
Okay, so culturally, I think I've seen a lot of alcohol use to help with symptoms. So I think alcohol calms you down in a lot of manias, especially. I've seen patients drinking a lot of alcohol just because it kind of brings them back down. But other drugs too, drugs are used for whichever, wherever you are. And I've seen a lot of that. I've seen curanderos, and especially in Peru, they have this belief that if they rub a guinea pig all over your body, the evil spirits will go away.
What is the guinea pig called?
Cuy.
Yes, I remember we were talking about that. Wow.
Yes. So you go to the specialist in herbal remedies or whatever, and te pasan el cuy. So they actually don't touch your body. They hover it over your body, and it's supposed to pull out all the waste products and all the evil spirits. And so that's a lot of stuff I've heard, especially growing up.
Just a curious question. Is it a live guinea pig?
I have no idea. So my direct family doesn't believe in this. So I know this is a Peruvian culture thing, but I just don't know. My family doesn't believe in that.
Okay,
either.
So you didn't grow up with that one, but you heard the stories.
Yeah, so I don't know, what it entails. I just know that it exists.
Okay, let's just backtrack a little bit for those that do not know what curanderos are.
Curanderos, kind of like a shaman here. So they do herbal remedies. They could do that, or they could do, I think I've heard of them doing like you go to their place and there's herbs here and there and there's fire and play some special music. And so in that way, I think it has a lot to do with the spirits, and they sort of like want to drag away the spirits, but they also do herbal remedies. So they give you like sometimes marijuana, or they'll give you whatever, and then they'll say, drink this tea every day for 2 months and you'll be cured from everything. So
yeah, curanderos are so common in our culture.
Yes.
And I know part of my family believe that it's witchcraft.
Mm-hmm. Yes, so my family also believes that it's witchcraft.
Yeah. Well, what type of treatment is recommended for someone that does have bipolar?
Okay, so mood stabilizers are number one. And it also depends on the type of bipolar. So if there's, depends on the symptoms or mood stabilizers, we have lithium, Depakote, Lamictal, and carbamazepine. And then I've also used antipsychotics, and Latuda is probably my favorite one, but you could use olanzapine, risperidone, Abilify, there's Rexulti. And it's important to note that these medicines are not only for bipolar, and just because you're taking these medicines, it does not mean that you have bipolar disorder. So, just because I just talked about these medicines, it doesn't mean that whatever you're taking it for is bipolar, but these are commonly used for bipolar disorder.
Gotcha. Yeah, that's a good disclaimer. And in terms of psychotherapy, what have you seen to be the best modalities for someone with bipolar disorder?
Okay, so CBT has a lot of research and evidence, and it kind of helps with fixing our belief systems. Sometimes with bipolar disorder, there's a lot of also psychological stuff that goes on that we kind of want to like fight our negative beliefs that cause our behaviors to be differently just because we believe something to be true. And also DBT. So that's dialectical behavioral therapy. And I've seen that helpful with some maladaptive patterns in behavior. And usually those patterns we kind of form as a protective mechanism, but they're not healthy patterns. So DBT is really helpful with that.
Yeah. And so we're winding down. What resources are available for families that have a loved one with bipolar or someone that has bipolar disorder?
So there are plenty of resources, but my favorite one is the National Alliance of Mental Illness. Mm-hmm. There's a lot of resources in that website for family members to provide support for family members. When you're dealing with someone with bipolar disorder, it's very difficult on the loved ones of that person too. So there's support for you, and there's support for you if you actually have it and you need help. There's phone numbers, there's websites, and it's national support system. So that's my favorite one for the public.
Mine too, especially because their services are free.
Yes.
There's so many classes, support groups, different types, very specific too for loved ones that have someone with bipolar disorder, for loved ones that have someone with schizophrenia. I know that they offer art classes as well, which is just really beautiful because the support is there. It's there. Mm-hmm. The diagnosis exists. So let's make use of the support that is available.
Yes.
Well, thank you so much, Elena. This has been such a very interesting and teachable segment for me, myself included.
Thank you for having me. It's been a pleasure, and I look forward to all the questions and discussing this further. There's a lot more discussions that could be had about bipolar disorder, so this will be just the beginning of hopefully this discussion for the podcast.
Yeah, and this is just an intro, right? Like there's just so much more. But thank you so much, and I'll talk to you soon.
Okay, bye.
Bye. Okay, that concludes this episode. The resources for today from Elena, as she mentioned, are NAMI, N-A-M as in Mark, I as in Igloo, NAMI, which can be found at www.nami.org, and also Mental Health America. They have bilingual resources. You can find them at mentalhealthamerica.net. I'm going to give you the NAMI helpline, which is 1-800-950-6264. Okay, so there will be other resources on the show notes, which can be found on my social media and also on the website. Let me know what you thought about today's episode. And if you have any questions or concerns, you can email me at latinxtherapypodcast@gmail.com.